submandibular, sublingual, and here parotid, so that less and less fluid are coming.
Close it by
Cotton rolls.
cotton.
Cotton roll here, here, here.
Okay.
Or better if you have a rubber dam.
Okay.
Okay. So first, if you press it like this, you see, it comes inside. So it's a small 2 millimeter increment. Initially, it depends upon your choice whether from which area you want to start. Usually I prefer to start from the mesial or distal, not in the center. So you will press it. Okay, so it goes in, and this one is empty now. So the increment is there, it stuck there. You'll use the condenser against the walls first, okay, so that it adapts to the line angles, and then to the pulpal floor. You see, this area is still a bit smaller than the condenser size, so we are having problems, you see.
Can you use this?
Yeah, we can use another one.
I think this is as well big.
Yeah, but this is basically a burnisher, not a condenser. But anyways, yeah, it's a bit bigger. So you condense the first instrument using at least 4 to 5 pounds per square inch of the force. So its force should be slightly like, if you see, when I press the head of the mannequin, it slightly, you see, slightly moves. So that's a sufficient amount of force that you can apply. Okay, it should be not too much that the patient says that you are hurting me, and it should be not so little that the condensation forces you cannot see. Then you will add another increment of 2 milli again, and you have to be when you start condensing, it means that your setting is started, so you have to be very quick. Okay, if you are not quick, it will set, and you will be left with the set amalgam, which is difficult to carve. So why we are using incremental approach? Why not place all?
Okay.
Yeah. Why are you not using all the amalgam at once in the cavity? Why not?
It's gonna be messy. It's gonna go out.
But if you condense it well, there will be space.
Yes, it will make the air out.
So incremental approach is better. You can see what you are doing in every increment. You see, I'm adding it to the previous one, so they are bonded together, and the voids are coming out. The more I press, the better are the chances of the removal of all the voids in between. There are different kinds of amalgams, okay, available in the market. The previous one, which was started initially, was lathe cut amalgam, but now the spherical shaped amalgams are also there. What are the advantage of spherical shape? You can place the whole amalgam in one go and condense it from the top, so it will flow into the cavity. Okay, less chances of.
So it has to be there with a rubber dam or something.
Yeah, most of the time, every time you have to have a rubber dam. These amalgams have very less amount of mercury. See, it becomes powder, most of it. So the lesser the mercury, the lesser the setting time. Okay, so you have to be very quick. Okay. Now you overfilled it, and you see some of the mercury is coming here and there. That is why isolation is very important. You cannot ask the patient at this stage to spit. Okay, he cannot spit because it will contaminate all the surface area which is already setting. Okay. Now we have an extra. We are finished with the condensation. We have extra amalgam there. Now we will do pre-carb burnishing. Okay. Ideally we should have a large burnisher, but anyways. So this is pre-carb burnishing. See, along the cavo surface margins, so that it become flush to that. Okay, and during the process, some of the amalgam is lost. Okay, this is the pre-carb burnishing. Then we start with the uh, with the carving. So carving is basically, with the practice you will know how to carve. Usually what I do is the in the middle, this one, lingual fissure as well as the buccal fissure. You start with this one towards the center.
From lingual and then
Yes, you can start from the buccal and towards lingual, it's up to you. And carve. You have to keep the design of the occlusal surface anatomy in your mind while doing it. Okay, so this is the central fissure, central pit. You can move towards the marginal ridge on both sides, keeping the blade, half of the blade on the tooth structure and half on the filling material. Okay, you see, so you will carve the inclined planes as well as the amalgam in one go using the same blade, and the rest of the extra amalgam will come out. Then there is a secondary groove here, the distal groove. You see here the distal groove, and we have spared the margin ridges, so there should be no amalgam here. Okay, you can use both ends for your convenience, whichever is convenient to you. You see the sound of the amalgam? This is a squeaking sound, okay? It means that it is ready for carving. Sometimes if you use a lot of mercury in the mix, this squeaking sound will not come. So you have to wait. You ask the patient to bite and wait so that it becomes a little set, so that you can do the... I can use the burnishing in between as well.
This is post burnishing?
No. I can use it because clinical scenarios are totally different from what you have learned in the lecture. It's individual preference. I usually used to use cotton to clear away the extra amalgam as well. Okay, so there are variations. So don't get yourself confused on these small variations. Okay.
how you should know the required level of the amalgam?
By looking at it, I'll show you. You see this carving, this everything, you have to make it parallel to this. Okay, by just have an idea, it is almost identical to this one, not too deep, not too shallow. In the actual patient, at the end you have to ask the patient to bite. So ultimately you will have the final. Again you will use the carver. Always keep your instruments arranged so that they get not lost. Okay. You have to carve it until and unless you know, you are satisfied that your carving is finished, you have done a good job, and then you can do a post-carve burnishing.
So this is too deep, or?
No. How it is too deep? It's okay.
From the proximal surface.
No, it's okay. You see the direction of the blade I'm using? Half on the tooth. Yes, half on the tooth and half on the amalgam.
So the sound structure will guide you through it.
Yes, it will guide you. It will guide you. When you do a lot of practice, even at the final stage, you will be, by just looking at it, you will find out which area is high and which one is low. With practice, you will know all this.
I shouldn't use the water, right?
No, water is not. No. If you use the water, it will contaminate. So the final properties of the, the final properties will be affected of the amalgam. So if you do a post-carve burnishing, you see, the shine appears. You see, it's a bit more shiny now.
Yeah.
So this is basically the post-carve burn. It's slightly, you are not supposed to use a lot of pressure during burnishing. The pressure can be used only in the condensation, and if the material is a bit set, you can use some pressure for carving. The rest is... So when you do burnishing, post-carve burnishing, some of your extra details are lost. It happens because it is in the setting stage. Okay, so what I do is usually use the half moon shape, yes, to reinforce those extra details if you want. Okay. But it should be used cautiously with experienced hands, because if you go deeper you will remove extra amalgam. Okay, and there will be, especially in those areas where the cavity meets the normal tooth structure, in those areas there will be a possibility of ditching. So for you it is not that much recommended. When you practice it a bit, then you can use this technique, and ultimately you do the burnishing to finalize your cavity. So you see your I like the carrot shaped burnisher in this situation because it has a tipped end, so it goes into those fine details. Although this is a bigger carrot, we have seen a lot smaller carrots than these, and it goes into the fissures even, so it even polish or burnish those fissures. So you see those fissures which I create on the probe, they stand out. They usually stand out there. Okay. At the end you will see whether there is any overhang or undercuts by just doing like this. I am not applying any pressure. Okay. So everything is good, seems good, and you can finalize. You see the sound? You can hear it. This is a squeaking sound. Okay.
Yes.
So this material is about to set. So almost like 5 minutes to 7 minutes you have this time to fill it, to carve it, to burnish it, to finalize.
How long will it take this off?
What? Why you want to take it?
Because I only have this teeth.
It will be a disaster for the patient. Okay, so this is how it is. Okay, so this is the initial burnishing. The final burnishing or the final polishing will be after 24 hours.